Welcome back to the Mom and Mind podcast. I'm your host, Dr. Kat. On our episode today, we are going to be talking about the importance of pelvic health. And man, I wish I had known this when I was pregnant and postpartum with my first. Um, it it is incredibly important. You're going to hear why and how important it is from our guest today, Dr. Laura Williams. She is a doctor of physical therapy and board certified women's health clinical specialist. She lives and practices in Colorado with her husband, 3-year-old daughter, and second child on the way. She founded a Hearth Healing, a 100% virtual postpartum healing service, as a pelvic health consultant. Though not a substitute for in person healthcare, postpartum healing consultation should be viewed as a vital way to bridge the gap in maternal care. People deserve information about how to improve symptoms that impact their quality of life after childbirth without having to wait months or feel limited by a lack of childcare or transportation. At Hearth, Laura provides individualized answers to postpartum healing questions, early healing strategies, self management advice, and guidance on appropriate resources, products, and providers. She lives and practices in Colorado with her husband, 3-year-old daughter, and second child on the way. She founded a Hearth Healing, a 100% virtual postpartum healing service, as a pelvic health consultant. Though not a substitute for in person healthcare, postpartum healing consultation should be viewed as a vital way to bridge the gap in maternal care. People deserve information about how to improve symptoms that impact their quality of life after childbirth without having to wait months or feel limited by a lack of childcare or transportation. At Hearth, Laura provides individualized answers to postpartum healing questions, early healing strategies, self management advice, and guidance on appropriate resources, products, and providers. She is talking with us today about really the lack of information about healing after childbirth, let alone what you can do during pregnancy, or that there are even options during pregnancy for pelvic health. She shares with us some of the symptoms after childbirth that people might be experiencing that are common but not necessarily normal, meaning they should not be accepted long term. There are options for health that are relatively easy to get to, but because we are not informed about pelvic health or that even we can get help for things like pain, she's going to tell us a little bit about how and why that help is important. Specifically, as pelvic health does impact mental health and your ability to care for yourself, and as Laura puts it, ability to care for your community as well. I'm really excited to get you guys this info, and I hope it is not the last time you hear about the importance of pelvic health, specifically in the pregnancy, birth, and postpartum world. Let's meet Laura. Welcome, Laura. Thank you for being with us.
Thank you so much for having me.
I am super excited to have you tell us all about pelvic health and what that even means. I think for some people, this might be the first time they're hearing about it. Other people are going to be, listening to this saying, yes, 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 talk about it and tell everyone because of just how important it is. So yeah, please let us know what is pelvic health.
Sure. So I am a doctor of physical therapy. That is my profession, and I was trained as a generalist. So I treat everything across the lifespan. I work in a rural setting, so I see lots of conditions that are not necessarily pelvic health specific. But since the beginning of my practice as a physical therapist, I've specialized and really honed in on pelvic health. And have since also acquired my board certification as a women's health clinical specialist. So,
Awesome.
what pelvic health is addressing issues surrounding the pelvis. And I specifically treat women. Pelvic health does apply to men as well. So, I deal in things that have to do with pelvic floor pain. So, pain with intercourse, pain with bowel and bladder function, intra-abdominal pain, things like endometriosis, dysmenorrhea, painful periods, and such. And I also deal with bowel and bladder dysfunction, so urinary incontinence, constipation, fecal leakage, those kinds of things. And I specialize in obstetrics as well. So I treat women across 4 trimesters. Really, I think of it as 5 trimesters.
Ooh, say more about
So
that.
Yeah. So the first 3 being during pregnancy.
Mhm.
I encourage people to come to me at any point during pregnancy, and I like to highlight that don't have to be in pain to see a pelvic floor physical therapist
Oh my gosh.
during pregnancy.
Yes. Yes.
So just being pregnant by nature is a massive physiological and biomechanical transformation that warrants support,
Mhm.
um, and that warrants expert understanding of your unique changes and how to help you really stay functional and stay active throughout your pregnancy,
Mhm.
and comfortable.
Mhm.
And then we treat people at any point postpartum from day 1 to week 6 and so on. We think of that first 12 weeks postpartum as the 4th trimester. And then I consider the 5th trimester being return to work, return to sport. A lot of that acute healing has happened, but now your body is starting to undergo more demand
Mm.
physically, mentally, emotionally,
Mhm.
um, and making sure that we've laid a really strong foundation to approach that 5th trimester well, without a lot of ongoing sequela and dysfunction.
Mm. Wow. Yeah, that makes a ton of sense. I haven't heard yet of somebody describe it in that way of like back to like this increased amount of stress on the body
Yeah.
after that fourth trimester. But it makes a ton of sense when you say it. Um, I know just with like sort of standard traditional Western medicine, postpartum is like barely given a month to 6 weeks to 8 weeks. But this is like you were saying, a long healing process.
Yes. And that doesn't end there, right? I
Right,
mean,
right, right.
our bodies are forever changed. We're
Mm-hmm.
always postpartum. Um, so, the in our country, we typically see our physician, OB, midwife, weekly leading up to pregnancy.
Mm-hmm.
And then as soon as a baby's born, we're sort of discarded until 6 weeks postpartum. We get that one touchstone appointment that's for us,
Mm-hmm.
um, and we're sent on our way.
Right.
And most people are not getting support from 0 to 6 weeks at all.
Mm-hmm.
And then the majority of people that I talk to across the country are barely screened at that 6 week visit for anything having to do with quality of life, right? So if you don't have an infection, if
Yeah.
you don't have a clot, you're able to walk, you're able to care for your child. Then as far as they're concerned, and as far as most physicians are trained to be concerned, you're good, right? You're good to go.
Mm.
And they're not asking the screening questions that really you're probably feeling, that most postpartum people are probably feeling and wondering about, but don't feel like they have a safe space to ask the questions.
Oh, totally.
So um, I'm really passionate about empowering people to understand how to prepare for postpartum and how to be their own advocates in that postpartum period, to ask for the resources that they know exist that may
Mm-hmm.
not just be being offered to them,
Mm-hmm.
and to know that that is the appropriate time to ask those questions at that 6 week appointment.
For sure.
And um, ACOG has been recommending seeing a maternal health care provider at 3 weeks for a long time, like since 2018.
Mm-hmm.
And that's still just not the standard of care.
Oh, like it hasn't yet kind of trickled down into the actual OB office. So
Yes,
everyone's still working off the 6 week model kind of a thing.
exactly.
Hmm. Well, I wonder how long it's going to take to change that. That's a
Right.
massive systems change.
Yep. Yep.
Oh,
Exactly.
right. So you're not really getting to talk to anybody. Um, which is tough because I mean those appointments are already hard to come by. So
Mhm.
if you need to see somebody sooner than expected, or you have questions, like you're saying, um, yeah, how are you going to get in touch with somebody in a way that feels meaningful and useful?
Right.
That's really tough. I want to circle back real quick to something that you were saying that I think is really important. That like because when people talk about pelvic health, or like maybe I can reframe it and say like the general public, general population. When you think of pelvis, you think of like sexual organs
Mhm.
mostly because it's sort of used loosely as a way to describe what's happening if you have a pelvic pain. But you're saying also that we're talking about bowel function, and I don't, think people are thinking of bowels as part of the pelvic region.
Yeah. So that's a great thing to circle back to. Pelvic health has everything to do with bowel and bladder dysfunction. And those are two systems that are very, very specifically impacted by pregnancy and delivery by any mode.
Mm-hmm.
So not just specific to like the perinatal period.
Mm.
I think in our culture, we've really um, made talking about bowel and bladder function very unattainable,
Mm. Yeah.
very stigmatized.
Mm-hmm.
And so people live with these things forever, for a long time, accept them as part of aging, a part of delivery, a part of
Mm.
postpartum,
Mm.
and just don't seek care that's actually really accessible and usually very successful and conservative.
Mm.
So,
What do you mean by conservative?
yeah, so I mean, non-invasive.
Mm. Mm.
So a lot of times, oh, this is such a loaded question that you just asked me. Um,
We have a little bit of time.
yeah.
Yeah.
So the the big picture is that too much of the time people are being offered really invasive procedures, surgeries, um, that are unnecessary to treat problems affecting the bowel and bladder.
Mm.
So urinary leakage,
Mm.
um, typically a multifaceted approach, including kind of behavioral modification. So the mental component of how we relate to our bladder,
Mm.
what we put in our system. So hydration, diet, bladder irritants,
Mm.
and then the biomechanical piece of how we manage pressure well in our system. So how we breathe when we move.
Oh, interesting. Mm-hmm.
All of those things really affect our bladder function. And by improving those things, or by looking at those three columns, those sort of three pillars that impact bladder function, typically most people can make tremendous progress. But our system isn't built to let people take that conservative, maybe a little bit longer approach
Mm. Mm-hmm.
first.
Mm-hmm.
It's built to do the most expensive thing, right? That
Mm.
provides money. Um, so the healthcare system puts
Or
money
like
back in the healthcare
procedures and
system.
surgeries and
Procedures,
yeah, yeah,
yeah.
yeah. Mm-hmm. Mm-hmm.
But often I find like in 4 visits, right, in an pretty uncomplicated situation where somebody has stress urinary incontinence, where they're leaking with coughing, sneezing, laughing, or urge urinary incontinence, where they feel like they have to rush to the bathroom.
Mm.
It takes about 4 visits for that person to see tremendous improvement, like 60 to 80% improvement.
Wow.
Um, but once someone's had a procedure, so say someone has some pelvic organ prolapse, right, some heaviness in the pelvic floor, a procedure was done, maybe that procedure is starting to fail at 10 years because that person never really was taught how to support that procedure, right?
Oh,
Because
right.
we don't encourage people to get PT after these kinds of surgeries like we do with other musculoskeletal surgeries.
Whoa. Like mind
Um,
blown. You're
yeah,
so right. Like
yeah,
almost every procedure, you have to go to physical therapy afterwards.
right.
Oh.
But if you have a pelvic organ prolapse and someone just puts in a sling, they
Mm-hmm.
typically don't send you to pelvic PT after the fact
Mm. Mm-hmm. Mm-hmm.
to teach you how to integrate that sling and how to re-educate those muscles that have been inhibited by surgery, let alone years and years of vaginal wall descent.
Wow.
So then they come to me 10 years later, and
Mm.
it's harder. It's not impossible to still create
Sure.
change, but it's
Yeah.
definitely
Mm.
harder.
Mm-hmm.
And the same thing goes for bowel dysfunction. You know, people don't want to
Yeah.
talk about it. They don't feel comfortable asking the questions.
Right.
Um, but the same rules apply, right? What are you
Mm-hmm.
eating? What are you drinking? How are you hydrating? What's the inflammation like in your system?
Mm.
Um,
Mm-hmm.
what are the behavioral pieces behind that? What's your relationship to food? What's the
Mm.
relationship to your toileting habits?
Mm.
What's your positioning on the toilet? And those are
Mm.
things that are all within our purview that can make
Yeah.
a huge difference for people.
Wow. Yeah, I just like whoever's listening. That this is like potentially so much great new information to just kind of sit with and absorb and maybe like rewind and re-listen to because um to all of your points, it's just not discussed.
Mhm.
Um and let alone women's women's health or sexual health in general.
Yes.
reproductive health, any of that. It's just super duper important because it's almost like in if I can be sort of dramatic for a second, like in medical systems, this is like almost like a void, the pelvic area, the pelvic pelvic health as you're describing. It's yeah, I don't know how many times I've personally heard just, oh, just take birth control if you, or like, oh, you have pain, that's normal. And it's just like almost untouched, like very literally, in terms of understanding like what's going on, but not even addressed or talked about.
Yep.
So this is all like super duper important info.
Yep. And I think coming off of your episode, 2 episodes ago, I think about unwell women,
Mm-hmm.
that got me really fired up.
Yes, yes.
Right? It goes
All of
back to
that stuff.
all of that messaging about like
Hmm.
the deep-seatedness of
Hmm.
not listening to women, not believing
Yes,
women,
yes.
disempowering women, disembodying women.
Hmm.
And, bowel and bladder function apply to men too. But I think because we're specifically here to talk about kind of this perinatal period,
Yeah.
this speaks to, just how much we sort of put up with and endure, particularly postpartum.
Yeah.
And a lot of these things that we're talking about, bowel and bladder dysfunction specifically, are
Mhm.
so critical in that time.
Mhm.
But women aren't given the space to process that that's something that's impacting their ability to care for themselves and care for their children.
Can you
And
yeah, well, I mean, really interested also to hone in on that, like, care for themselves and care for their children, um, because of course, yeah, if you're even if you're well, I mean, I'll let you talk about it, obviously. You're saying even if there's not pain, there might be, some dysfunction or somehow impacting how that person is feeling,
yeah,
just physically, but also mentally.
yes. So, part of the reason that I was really drawn to pelvic PT is because I feel like you said, like, this is not a place that is touched both
Mhm.
physically and sort of metaphorically, right? And
Mhm. Mhm.
um, part of it is that a lot of doctors aren't trained, right, to
Mhm.
screen for these things.
Mhm.
They don't know the scope of our practice. I think pelvic health as a part of the physical therapy profession is about 15 years old now. So, in the grand scheme of medicine, that's still relatively new, and we're doing a
Mm.
lot of education still with physicians.
Yeah.
Um, but it is like this black box in the
Mhm.
body, right, that
Mhm.
people are afraid of. They're afraid
Yeah.
it's delicate to talk about. Often it is trauma-informed care, and so that makes it
Yes.
particularly unique and
Mhm.
requires additional training.
Yeah.
But when I think about my practice as a pelvic health practitioner, I really think it's made me a much better generalist because
Mm.
we can't treat a whole person without acknowledging that this part of our system exists
Totally.
and that dysfunction in this part of our system affects our whole body, our whole habitus, right? So,
Mhm.
um, yes, sometimes it is painful, right? Sometimes we are losing certain function. I think of sexual intercourse as an activity of daily living.
Mhm.
If you lose your ability to be intimate with your partner directly because of painful intercourse,
Mhm.
dyspareunia,
Mhm.
or because you've lost this self-efficacy and a sense of home in your body and you just don't feel safe being intimate anymore,
Mhm.
that's a function. That's a functional loss. And as
Yeah.
physical therapists, our job is to help you maintain function and optimize quality of life.
Mm.
Um, and when I talk about losing your ability to care for yourself and your family and your community, that's about that loss of self-efficacy, right?
Mhm.
And
Mhm.
self-confidence. And when we have something going on like leakage, right?
Mhm.
Postpartum, we have leakage when we just stand up from a chair,
Right.
or we urgently have to run to the bathroom, or we're at dinner with friends and we have to run to the restroom, or
Mhm.
maybe a little bit farther down the line, now you're back to running and you're leaking with running, and that's embarrassing or uncomfortable or frightening.
Mhm.
Um, that makes our world start to get smaller,
Yeah.
right? We start to kind of
Yeah.
move those things up and edge out of those spaces, because of that shame.
Yep.
And then we lose sort of that sense of self-confidence and um, desire to be a louder voice, have more say, show up more fully, participate more.
Mhm.
And I really
Mhm.
believe that disembodied women raise disembodied children,
Mhm.
So this whole notion that once we have babies, our whole life should be about raising our babies and we should let go of our sense of self and you don't
Mhm.
matter anymore
Mhm.
is so contradictory to what we really need, which is to
Yeah.
feel like really good in our skin
Yeah.
and have that time carved out for self-care,
Yep.
which may mean going to a pelvic health physical therapist and relaying down this motor plan so that you have good control and um, skills, right? Even if
Mhm.
healing takes time, just having a plan can be really powerful.
Yes.
And then we're demonstrating to our children, I prioritize my wellness so that I can prioritize yours.
Mhm.
And I encourage you to prioritize your own.
Whew. Yeah. That is a shift, a societal shift that is been really hard to change.
Yeah.
That taking care of yourself, isn't selfish. Maybe that's a played out phrase, but it's super true.
Mhm.
And I mean the sort of domino effect that I was hearing when you were describing that is it maybe would be subtle at first, maybe not, depending on if there is injury or something like that that needs more intensive healing. But I mean, that could go on for years,
Yep.
years, years and
Yep.
years. Um, and if you don't have the information to know that this could be part of what's impacting you, but just specifically from a mental health perspective, um, connected to what you were saying is like people don't blame that, like, oh, I have a pelvic health problem or pelvic floor dysfunction. That's why I'm depressed or that's why I'm anxious or whatever. You know what I'm saying? Like it doesn't get pinned on some physical thing. It becomes like or like, a real physical thing. It becomes something's wrong with me,
Mhm.
like me who I am.
Mhm.
And that is really tough, especially when you're potentially had a birth that had trauma, mental, emotional, or physical, or yeah, whatever. You're just trying to figure out how to be a new parent. Um, it gets so murky in there that it's you wouldn't maybe necessarily think first, like, oh, I should check in and make sure my pelvic function is okay.
Absolutely.
Ooh.
And have we've normalized it. I mean, we
Mm-hmm.
know childbirth is trauma. It's physical trauma, however your baby is delivered. And there's a real range, right? Now, whether it feels, I say that as it's physically traumatic. So
Mm-hmm.
major uh, injurious thing that happens to our bodies, whether there's trauma associated with that, right? Whether we say my birth was traumatic has a lot to do with so many other variables,
Mm-hmm.
like the way we were treated,
Right.
the agency that we felt we had, whether we gave informed consent throughout birth, um,
Yes.
how people put their hands on us afterward, what was
Mm-hmm. Mm-hmm.
explained to us versus
Mm-hmm.
not time, right? Feeling rushed through the process. Those are the things that typically lead to like that was a traumatic birth for
Yeah.
me
Yeah. Yeah.
versus there may be grief around the way the process happened. There may
Mm-hmm.
be injury. It may have been a cesarean was needed or some other intervention was needed. But if those things are explained along the way and people are given choice and they understand
Mm-hmm.
and they're given options, typically they come out on the other side able to reconcile that and process that.
Yep.
But totally to your point, when you've gone through something that felt traumatic, and now, especially if it's your first baby, you're caring for an infant, which is a complete shock, no matter how prepared you think you are, right?
Mm-hmm.
It's something totally other.
Yeah.
You've lost your identity in terms of the way your days used to look or be
Oh yeah.
structured. You're on this 24/7 schedule. You're completely exhausted. I call it like prisoner of war torture, sleep deprivation. Right? It's that level. And then you're expected to think through, I wonder what all my resources are and how I could best care for myself, right?
Right, right, right.
So that's why I
Yeah.
think we need to put more onus back on the providers that are actually interfacing with people in this period,
Mhm, mhm.
do a better job of asking the right questions and screening. And until that happens, I'm making it my mission. And I think a lot of pelvic PTs agree that a lot of this preparation just has to happen prenatally.
Yes.
And it's really hard to put yourself in that mindset of what you're going to feel like postpartum because you really don't know, and every postpartum experience
Yeah.
is unique.
Mhm.
But there are universal things that help, that if we kind of stack the deck in our favor ahead of time, um, can soften the blow and ensure that the right people are around you that can offer the services you don't even know you need.
Right. How what are some things that people would like tip them off that maybe they do need support if they haven't already like had that pre-childbirth education?
Yeah,
How would somebody know to contact you or a pelvic PT?
sure. So, just a baseline, if you've been pregnant and you've delivered a child, that warrants either a consult or an in-person evaluation by a pelvic health physical therapist, period.
Mm,
And you do not have to wait 6 weeks to see one. So the reason we have that 6-week mark is that that's sort of when our acute healing phase is over,
mhm,
and that's when, statistically, infection risks go down.
mhm.
So, we tell people nothing in the vagina for 6 weeks after delivery, like we're chomping at the bit.
Right.
Um,
That's it.
but there's
Right.
so much in a pelvic PT's scope of practice that does not require doing any sort of internal evaluation. So that
Hmm.
is part of what we do. We do evaluate the pelvic floor, the inside of the pelvis, right? The muscles that live on the inside of the pelvis with one gloved finger. So it's much less invasive than a gynecologic exam.
Oh, okay.
I think that's important to just share because I don't know if everyone
Yes.
knows that.
Oh, for sure. Yeah. Those details are helpful
Yeah.
because just as you were saying that, I'm thinking of like all the people who have kind of winced or been like, oh, I don't want anybody, doing that. And maybe for very good reason, like you said, potentially there's like trauma there or they're just uncomfortable or whatever. Um, but the more people know about what actually happens, I think the more
Yeah.
likely they will be to reach out.
Yeah. So what's paramount to us is trust, and um, really building that relationship with our clients and our patients before we do anything ever that feels remotely invasive. So we always get consent. We always offer a chaperone. Um, and I ask for consent at every visit. So if
Hmm.
I've been working with someone for 6 months, I still ask for consent before we do anything at all intimate, right?
Right.
Around the breast tissue area, around the pelvic floor. It's
Hmm.
always my patient's choice, and there's never any pressure that that has to happen. There's so much
Awesome.
information that we can glean without ever doing an internal exam.
Hmm. Hmm.
By the time we do an internal exam, it's usually because my client and myself believe that there's really valuable information that we need to gain from doing that, that we
Hmm.
both want.
Hmm.
So we're looking at things like the coordination of those muscles, just like the coordination of muscles
Ah,
anywhere else in your body, right?
mm,
The
mm,
strength of the muscles, but
mm,
also, and often more importantly, the ability for those muscles to relax fully.
mm.
Because when we've experienced trauma or we've experienced an injury, our body's response is not usually to just open up and lengthen and receive, right? It's to guard and shut down and close off and
Yeah.
shorten.
Right.
And when our muscles live in a shortened position, then they aren't able to receive input as readily. They're not able to
Mm,
respond as effectively as they need
mm,
to. So if your muscles are in a really shortened position and then you cough or sneeze and those muscles are already contracted and we need them to contract more to stop the flow of urine, they're unable to do that because they've been living in this really shortened position where they're not getting good blood flow and they're not getting good oxygenation.
interesting.
So
Fascinating,
sometimes,
really. Yeah, yeah, yeah.
yeah, so a
Hmm.
lot of times it's about offering input to those muscles to encourage them to relax,
Yeah.
to get back through full range of motion.
Hmm.
And we're also addressing things like scar tissue. So if you've had perineal tearing or other tearing from childbirth, that's something we want to address, and that's something that can be moved and optimized.
Hmm. Hmm.
Um, so that's why we do internal exams,
Hmm.
right? But it's
Hmm.
certainly not at all the only thing we do. We're looking at the movement of your abdominal wall, we're moving your abdominal incisions, we're checking your visceral mobility, so how your organs are moving.
Mm,
Looking at your low back and your hips and your pelvis and asymmetries in the body and how muscles are balanced and firing and all these dramatic changes that happen during pregnancy that linger postpartum.
mhm.
Sometimes just bringing the external muscles of the pelvis and low back into balance can improve pelvic floor function.
Mhm,
So
mhm.
I hope that people don't shy away from seeing pelvic PTs because of the internal component of it, because it's certainly
Yeah.
something that never has to happen.
Mhm.
And it would only be used sparingly in a really necessary circumstance, and it can be incredibly helpful when it's appropriate.
Yeah, for sure. Amazing. Thank you for that. That's
Yeah.
so helpful.
And I think,
Yeah, go ahead.
sorry, just you asked, what would people look for?
Yeah.
Know that they needed to see a pelvic health PT.
Mhm.
So I
I'm
often
talking like specifically after, childbirth.
childbirth. Mhm.
Mhm.
So I talk a lot about things that are common but not normal,
Mm. Mhm.
right? But
Yeah. Yes. Yeah. Please expand on that as much as
sure.
possible. It's an important distinction.
Yeah. So the first one, which we've touched on a lot, is urinary leakage.
Mhm.
So this idea that we just pee
Oh.
our pants a little forever because we had
Uh-huh.
babies,
Uh-huh. Yeah.
we've got to put that to bed.
Uh-huh.
We don't
So
have to do
that's
it.
this is it's common, it happens a lot, but it's not normal, meaning um
It shouldn't
shouldn't
it
be
shouldn't go
happening.
on forever.
Uh-huh.
Yeah, that's exactly what I mean. So something that is common, it happens to a lot of people. Um, when your muscles are stretched to their max capacity during a vaginal delivery, or when you've had a cesarean birth and now you have layers of scar tissue all the way down to the bladder, that will impact your bladder function. But that can all be re-coordinated and improved.
Mhm.
So it's not, generationally, we've just been told this is just what happens. And
Mhm.
now we know more. Science knows more. We have
Mhm.
evidence to prove that it can absolutely be remediated.
Awesome.
With really simple strategies, they just need to be individualized. So that's something that you shouldn't have to live with. You shouldn't have to live with leakage with running, leakage with jumping, leakage with coughing, sneezing, picking up your kids forever.
Mhm.
And if just physical therapy does not resolve those issues completely, there are tools, there are products that can help support the vaginal wall so that leakage doesn't happen during those more high impact times.
Mm, mhm.
The next one is pain with intercourse. Pain is,
Mm,
intercourse does not have to be painful forever after childbirth either.
mhm. Mhm.
Um, and again, that is usually a product of too much tension in the tissue, which is a guarding response to what it's been through.
Right. And this is true, I assume, through like a vaginal birth where there was no tearing or no specific injury, all the way
Absolutely.
to when there is
Absolutely.
an injury.
Absolutely.
Hmm.
And I find that just as often I have people in my clinic that have experienced what on paper is a normal spontaneous vaginal delivery with no tearing,
Hmm.
that are now experiencing things like heaviness in the pelvic floor, leakage with jumping, running,
Hmm.
um, and so on,
Hmm.
right? But didn't have
Yeah.
anything traumatic happen on paper.
Hmm.
Everything
Hmm.
went well on paper.
Right.
And other people who have had really wildly, um, what's the word I want to use? More invasive births or more injurious births, where they did have a lot of injury and they did have a lot of pain, but they've recovered quickly and actually
Hmm.
don't have any ongoing issues, or had an emergency cesarean and are healing beautifully and don't have any dysfunction.
Hmm.
So those people are still in my clinic, right? We're still helping close an abdominal separation, a diastasis recti.
Hmm.
We're working on cesarean scar tissue. The pelvic floor and the deep core still need to be recoordinated after just pregnancy,
Hmm.
regardless of mode of delivery. There's still so much. Sometimes it's nice to just have 45 minutes of self care in my clinic,
Yeah.
right? So
Right.
there's still so much that we're doing to support people regardless.
Mhm. Mhm.
Um, so those are two huge ones are, urinary dysfunction and pain with intercourse. And then I would say anything else that interferes with your ability to get back to something you were doing prior to pregnancy.
Mm. Mhm.
So low back pain, hip pain, those are things that you shouldn't have to just endure
Ooh,
forever.
can you say right. So this I think that might be another thing where people don't associate with pelvic floor function is hip pain.
Yeah.
Uh and
Yep.
low back pain. You did talk about that
Totally.
before, but
Yep.
that yeah. What are those why why are those connected?
Sure. So when we're pregnant, our pelvic floor, the muscles of our pelvic floor and our deepest layer of abdominal wall work together to just support us, support our
Mhm.
spine, support our pelvis. And they get stretched so much during pregnancy that when our muscles are too lengthened, they're kind of inhibited and they don't communicate with each other as well.
Mhm.
So after we deliver, those muscles are still in a lengthened position and it takes time for them to recoil.
Mhm.
And without really re-engaging the pelvic floor and the deep core together in a specific way. So often I talk about Kegling and wrapping the deep core on an exhale or exhaling to exert. So every time you do the hard part of a movement, breathing out
Mm. Mhm.
so that you're releasing pressure somewhere safe and that pressure isn't pressing down on your pelvic floor, causing leakage or out into your
Mm.
diastasis or out into your low back or wherever that vulnerability is now in your body.
Mhm.
If we don't lay down that groundwork and that foundation, our bodies are really smart and they're really resilient and they will figure out a way to keep you upright.
Mhm.
But other muscles will take the place of the muscles that used to be really good at stabilization.
Mhm.
And then we develop these
Mhm.
biomechanical patterns that are much less efficient.
Yeah.
So we're using big mover muscles to do stabilizing work. And then we develop asymmetries. We overuse those muscles
Mhm.
and we develop pain.
Mm.
And
Mhm.
so a lot of the time, low back pain and hip pain as a sequela of childbirth are sometimes it's because of childbirth positioning, which I could go on and on about as well. But often it's because we just didn't get that good foundation back in place
Mm.
and went like,
Mhm.
cool, I've been cleared at 6 weeks. I'm going to go for a run. I'm going to go
Uh-huh.
back to
Uh-huh.
CrossFit.
Yeah, yeah, yeah.
And so our muscles aren't in the same coordination that they were prior to pregnancy. We're strategizing differently. Things take over that aren't efficient. And then we develop
Mm.
pain patterns.
Mm. Man, as you're talking about this, like, yeah, this education should be a part of everybody's pregnancy.
Yes.
I
Yes.
it's so sad how little we know about how our own bodies function. Well, so here we are. We're talking about it. This is
Yep.
part of that.
Yep.
I'm like,
It's a
how do
step
we
in the
fix
right direction.
everything? I don't know. Uh, yeah, right.
Yeah. So my answer to this problem, my solution to this problem, which is one small drop in the bucket, is to try to be a virtual resource for people to bridge that gap from 0 to 6 weeks, but also to be a virtual offering at any point postpartum.
Hmm.
So there are also a lot of reasons that people can't get to pelvic PT
Oh,
in
for
person on
sure.
a weekly basis.
Yeah.
Certainly 0 to 6 weeks, but even beyond that, right? We have no standard
No.
maternal care in this country. We have no standard leave policy. We have no paid leave. I personally am about to take 16 weeks of unpaid leave
Hmm.
by choice
Hmm.
because I want that time with my second child.
Hmm.
And that is a priority for me, but it's a strain on my family. And I have a doctorate,
Hmm.
right? I have lots of education. And so
Hmm. Hmm.
the way we're not supporting people makes it really difficult for them to get these resources. So
Absolutely.
if you have to go back to work at 2 weeks, how are you going to prioritize a pelvic health visit every week? And there's a transportation component and there's a
Yeah.
childcare component. And if you have had a significant birth injury that potentially keeps you in the hospital for a prolonged period of time,
Mm.
or doesn't allow you to leave your home, or you're
Mhm.
having difficulty ambulating. Those are all reasons that
Mhm.
people might not be able to get in to see us.
There's just I mean, as you're talking about it, I'm thinking of my own personal experience trying to find a pelvic PT. First of all, there were maybe two
Yes,
in my area that had adequate training. And when I say in my area, I mean within a 40-minute drive.
totally.
That had adequate training that
Mhm.
understood specifically what my needs were. Um, and when I tried to go through insurance, that was uh, like nearly impossible to do. And then there's like figuring out how to do the out of pocket cost for something that you need. And there's I don't know if you have the numbers on this, but as far as I understand, there are not enough
No.
adequately trained people doing pelvic PT. I,
No.
I ran across a couple of people that probably shouldn't have been telling people that they do pelvic PT. And I could only know that having gone to somebody who I knew to be a highly trained specialist.
Yep.
You know,
Yep.
it's
And
tough.
that's huge. That's a huge piece. And then when you do find one, there's often a really long wait list because of that,
Yes, yes,
right? So
yes,
then
yes.
you're done with your fourth trimester by the time you even get in to see someone.
Right.
And a lot of healing has happened. A lot of
Mm-hmm.
scar tissue has been laid down. A lot of motor plans have been laid down. You've been living in pain for a long time or living with
Mm-hmm.
dysfunction for a
Mm-hmm.
long time. So there's a lot of problems associated with what you just described. And yeah, there's
Yeah.
a big push in our field to train more people, like to
Yep.
get more people the sort of baseline fundamental information about how to treat the pelvic floor, which usually means taking a pelvic floor level 1 class, which teaches you the fundamentals of doing a safe internal vaginal exam. But it takes years of clinical practice and integration and
Yeah.
lots and lots of specialty training to get to the point where you can treat these things well and to understand the nuance of it.
Yeah. Oh, it's super rough because I mean, we're here talking about how important this is. And then at the same time, other side of the coin, whatever, saying how hard it is to get into it. Somebody who can help you.
Right.
Okay. So now I'm thinking like maybe these appointments should be sought before, just like preemptively,
Totally.
proactively,
Yes.
to have it set up.
Yes.
But then, sorry, circling back to like, how do you do virtual
Yeah.
pelvic support? Yeah.
Sure. So in my clinical practice, I see people, and we have an incredibly well-established relationship with our physicians. So we have family practitioners, internists that perform deliveries at our hospital,
Mm-hmm.
and they send all of their patients that are pregnant to us. Period.
Nice.
So during pregnancy, we're really educating people on what to expect postpartum. We do labor and delivery training that focuses on the biomechanics of birth. Everyone in our hospital is seen by an acute care physical therapist before they're discharged. So they
Uh-huh.
get fundamental information about healing,
Mm-hmm.
regardless of how they delivered before they leave.
Mm-hmm.
And I encourage my patients to come back to me like at 1 or 2 weeks postpartum, not to
Mm-hmm.
wait 6 weeks anymore,
Mm-hmm. Mm-hmm.
and schedule that visit, yeah, before their baby is born.
Mm-hmm.
But that's an idealistic way of doing this. That's not the norm across the country, and certainly not
Right.
in big tertiary hospitals.
Yeah.
So my recommendation for sure is that everybody just goes to see a pelvic PT as part of their care team during pregnancy, no matter what,
Mm-hmm.
because you've established a relationship, and it gives you an opportunity to find someone that you resonate with and you feel safe with.
Yeah. Yeah. That's important.
And then you're on their radar and you're on their schedule, and they can
Mm-hmm.
continue that care postpartum rather than you having to reestablish care.
Mm-hmm.
My virtual business is called Hearth Healing, and this was a response to what I was seeing in my friends having babies across the country, and clients I was hearing from in other parts of the country, that no one was screening for any sort of pelvic floor dysfunction.
Mm-hmm.
They were being discharged after childbirth with no information about their own intrinsic healing.
Mm-hmm.
And by the time they realized that pelvic PT was a thing, as you said, they either couldn't find someone in network, couldn't find someone local, or had to wait 12 weeks to see someone in person.
Mm-hmm. Mm-hmm.
And I just kept thinking, there's got to be a better way. There's got to be a
Yep.
better way. And so what I've created is an online virtual space where you can come to me and set up initially just an hour-long consult. It's 100% cash pay. And my job is to help get people started.
Mm,
So I'm actually not working under my license. I'm working as a consultant.
mm,
And
mhm,
so
mhm.
what I'm not doing is I can't diagnose you.
Right, right,
I'm not doing any specific intervention. Um, I can't do a full physical evaluation, right? I can't evaluate your pelvic floor over
right,
Zoom,
right.
but I can glean a lot of information from a conversation and from
Mhm,
watching a little bit of movement
mhm,
and get people started with really fundamental early healing strategies. So, how to start to move better, how to start to lift more safely,
mm,
how to start to re educate their bowel and bladder.
mm,
I offer products and resources and classes that they can start to implement right away. Tools they can use to self mobilize their tissue, right?
mm,
People can be working on their scars day zero. People can be using breathing techniques to lengthen and contract tissue, and then help people understand where they need to go next and help people siphon out like the abundance of information on the internet,
right.
right? So there's tons of experts, there's tons of influencers.
Uh-huh.
Some of them are phenomenal and offering really, really well curated information, and some of them are less experienced.
Mm,
Um, but I think the more important thing is that not every piece of information is right for every body,
yeah,
every stage of healing.
yeah,
And so my real job as a virtual consultant is to help people understand where they are and what's right for them right now,
yeah, yeah, yeah.
and then bridge that gap until they can't, there's no substitute for in-person healthcare, but bridging that gap until someone can get in and talk to a real human in real life and be evaluated.
For sure.
You just shouldn't have to wait so long to get some fundamental information.
Yeah, you're so right. Um, that just being able to have that support, like you were saying, while you're waiting, because that wait could be a really, really long
Yeah.
time.
And from the comfort of your home, right?
Mm.
I always say, like, come as you are, nursing naked with your wine, with your coffee, I don't care. That's part of the
Yeah,
challenge, right?
yeah,
Bring
yeah.
have your baby, you're at home, you're staring at your computer anyway. Meet with me for 1 hour.
Hmm.
I do offer follow-ups, but I really feel like this just 1 hour of insight
Hmm.
and connection
Hmm.
can be life-changing for people, and so
Yep.
that's what
Yeah.
I'm trying to do.
That's awesome. Yeah, I mean, I think, and I guess I assume that there aren't a lot of people doing what you're doing, specifically the virtual consultation, the
Mhm.
bridging the gap part of this.
Yeah. It's a facet of a lot of businesses, like, a lot of people that have private practice will do a telehealth visit or
Hmm.
offer a free consult, but I really wanted to make this the backbone of the business.
Hmm. Hmm. Yeah, I mean, just I know we've only like touched on a little bit of of all of the stuff that you do. I mean, although we've touched on a lot of different points, but there's so much to know about pelvic health, and I think somebody had described it to me. One of the good pelvic physical therapists that I went to sort of showed me how like that pelvic floor is like holds up everything inside of
Mhm.
us, and how incredibly important that is. As to use some of the words you use as like our foundation, um, our center, our where we find our strength, and um, man, it really does go through a lot during this pregnancy postpartum time.
Yeah.
I thank you so much for all of this information. It is so incredibly important, and I'm glad that we were able to hear from you and get some of that education out there, some of the information out there. And for people who are interested in learning more, they can go to Instagram, Your Hearth Healing, and that's the website as well, correct?
Yep, yourhearthhealing.com.
Thank you so much. And best of luck, best wishes to meeting your new one.
Thank you so much. Thanks for tolerating my breathlessness.
No, you're
I'm
good.
3 weeks out.
No, yeah, there's not a lot of room left
Yeah,
for your lungs.
but I appreciate you having me. It's been a pleasure.
Absolutely. Thanks so much. Please find Laura and her services at yourhearthhealing.com, on Instagram at yourhearthhealing, and Facebook at Hearth Healing. Look around in your area to see if there are providers who specialize in pelvic health, specifically as it relates to pregnancy and postpartum. Some of those providers are available, and sometimes they are just not, which is why I think it's so incredibly important what Laura is doing to provide information about what you're going through and potentially some options to support you in your early healing journey. Thank you so much for joining us. Until next time.